Having lived in Germany for over 10 years, I know from my own personal experience what single-payer healthcare is and how far superior the care that each individual receives over our current U.S. healthcare system. This is definitely not the best healthcare system in the world, as I have so often heard and been told by other Americans. We need to work to pass this H.R. 676, which is really the only universal health care plan currently being considered. I also wanted at the same time to say that we have the chance now to learn from other countries in the world who have been working on this for a long time. We need to develop a rational, single-payer system that's grounded in a different point of view and practice from the current one in which prevention is as important as treatment. Integrative approaches to healthcare must be adopted as the standard of care and rigorously studied. We must develop a research program which serves the needs and priorities for our nation's health, rather than one that uncritically reflects a narrow medical perspective. Thank you. The NIH spends $30-some billion their budget. It must be put to the best possible use with a far more significant percentage, up from the current 2% that they're spending to perhaps we could have them spend 20%. Explicitly dedicated to studying the effectiveness of prevention, self-care, and wellness. An additional 20% of the budget needs to be shifted away from the single intervention studies where they study one drug or one procedure on which the NIH grants focus. Instead, we can study comprehensive, integrative, and individualized programs of care for the chronic illnesses that beset our population and consume our healthcare dollars. Approaches that appear to be likely to produce the best results. For example, nutritional, mind-body, and exercise interventions for arthritis, heart disease, and chronic pain, chemotherapy along with nutritional therapy, acupuncture, herbs, and group support for cancer. Finally, 10% of the budget that is allocated to single intervention studies should be awarded to research on non-patentable approaches, including mind-body therapies, herbal remedies, therapeutic dietary programs, acupuncture, musculoskeletal manipulation, and so on. These and many other health-related issues needs to be discussed in our communities throughout the country so we can really have the best healthcare system in the world. Thank you.